In this video, I'm going to talk about one of the more common overuse injuries in Kendo, Achilles tendinosis. Before we get started, a quick disclaimer. I'm not a doctor and this shouldn't be construed as medical advice. This comes from my own experience with Achilles tendon issues in Kendo, and my hope is that it'll help you make more informed decisions with your own doctor or physical therapist. Also, in my day job, I'm a journalist and I've covered science and medicine for several years, and I have an ongoing interest in sports medicine, both in theory and in practice. Tendinitis is generally an acute inflammation, while tendinosis is a chronic degeneration. To oversimplify a bit, tendinosis is what happens if you keep on getting tendinitis over and over again. So if you have a chronic soreness in your Achilles, it's probably tendinosis. Among Kendo practitioners, Achilles problems tend to be more common on the left side because if you're in Chudan no Kamae, you'll be doing fumikiri with your left leg. Fumikiri is that explosive jump forward. The classic symptom is soreness in your Achilles, especially near the heel, and if it gets to the point where you feel a bump in the Achilles, then you need to go see a doctor pronto. If you keep pushing through the condition, that could lead to a partial tear of the Achilles or even a complete rupture. That's a catastrophic injury that requires surgery and at least 6 months of rehab. The first line of defense against a repetitive stress injury is rest. If your Achilles becomes so sore that it becomes a distraction during keiko, where you have to pay conscious attention to your footwork rather than focusing on your opponent, then you really should consider taking a break for at least 6 weeks. I think the reason some people keep pushing through the injury, and I've been guilty of this myself, is that the soreness tends to ease a little bit when you get thoroughly warmed up. Let's face it, it sucks taking a break from training if you enjoy it. But if you struggle through the pain and keep practicing, then an injury that might have gotten better in a month or so could become a chronic condition. The problem is that the Achilles tendon, unlike the calf muscles, doesn't have a good blood supply, so it's harder to heal. But that doesn't mean there's nothing you can do. The answer to this simple question is actually quite complicated, but studies have shown that stretching is not a very effective way to rehab an injured tendon. As a general principle, you have to strengthen the muscles and tendons supporting the injured area rather than stretching the injury itself. This is also why night splints don't have very good long-term success with plantar fasciitis, even though it can offer short-term pain relief. If you have a mild case of Achilles tendinosis, then you can try taking a non-steroidal anti-inflammatory drug, an NSAID, like ibuprofen, for a few days. But the problems often return, so you have to do something to get to the root of the problem. We'll get to that later. And make sure you don't take NSAIDs on an empty stomach because there's a real danger of gastrointestinal bleeding. More than 100,000 people go to the hospital every year in the United States due to serious cases of gastrointestinal bleeding from NSAIDs. Icing may help relieve pain temporarily, but there's growing evidence that you shouldn't ice a chronic injury repeatedly. This is a point that even a lot of medical professionals aren't quite up to date on, because icing has become so ingrained as part of a treatment regimen that goes by the acronym RICE. That's rest, icing, compression, and elevation. Inflammation is the body's natural mechanism to heal an injury, and research suggests that repeated icing can actually hinder that process, prolonging the time that it takes to heal a chronic injury. You've probably seen athletes in the Olympics with kinesiology tape on various parts of their bodies, and it's become quite popular nowadays. The studies, however, are still inconclusive as to whether they help injuries heal faster. But there is some evidence that kinesiotaping has some modest effect in reducing pain and increasing range of motion. When you can't avoid practice, for example, let's say you're at a multi-day camp or at a team practice and you just have to get through it, then kinesiotaping could get you over the hump. However, you have to ask yourself whether it's worth the risk of prolonging the injury to soldier through the training. This is a question that you're going to have to answer for yourself, and your experience as an athlete and awareness of your own body will inform this decision. I've used two different brands of kinesio tape, one called KT tape and another one called rock tape. The rock tape comes in long rolls, so you can cut it to any length you want. This is the one that I use nowadays. I find that the adhesive is a bit stronger, so it stays on a bit better. If you go with KT tape, I'd recommend getting the Pro version. It's a little bit more expensive than the regular version, but the adhesive is stronger. I'll put links in the description below where you can find both brands. You should keep an eye out for sales from various vendors because you can sometimes find these at a discount. Once you apply kinesio tape with good adhesion, with your skin free of lotions, it'll stay on for multiple days. For the Achilles, this is how I tape it. Make sure to round the corners so that it doesn't snag on your clothing. Note that it's okay for the end of the tape to be on your heel, because if you're doing footwork correctly, your left heel won't be touching down on the floor anyway. So peel off one end, apply it to the heel, grab the other end, stretch it across the Achilles, and the end should have zero stretch, just the middle portion. And you can use the paper to cause some friction. That'll heat up the tape. And make sure that you have good adhesion. I'll also include a link in the description below to a video of how KT tape recommends taping for the Achilles. I should emphasize though that kinesio taping is a stopgap measure, so you need to do something to address the underlying cause of the Achilles tendinosis, not just addressing the symptoms. In my case, it never got to the point that I needed a shot of cortisone or corticosteroids, but that is one of the treatment options. Used under the right conditions, a cortisone shot can work wonders, as I found out when I got a cortisone shot for my tennis elbow. But it also has some side effects that you have to be aware of. The most important and potentially dangerous side effect is that corticosteroids can weaken the tendon, increasing the risk of a rupture. That's why doctors recommend not getting multiple cortisone shots in one location. One of the major discoveries in physical therapy in recent years is that the best way to rehab a tendon is to put it under load on what's called the eccentric motion, which is the lengthening motion. In the case of the Achilles, going up on your tiptoes is the concentric motion when your calf muscles contract, and going down is the eccentric motion when your calf muscles lengthen. A very well established rehab exercise for your Achilles tendon is to stand on the edge of a step, then go up on both sides, shift your weight to the side with the tendinosis, and then come down slowly, making sure that your heel goes below horizontal in a full range of motion. You may need to hold on to something to help you balance as you come down on one leg. You can also go up on the good side and come down on the side with the tendinosis. What you're doing is putting the Achilles tendon under a greater load on the eccentric motion. You can try doing about 10 to 20 reps twice a day, adjusting the reps as necessary. Another way to rehab a tendon is to realign the collagen fibers with a specific massage technique called augmented soft tissue mobilization. You're basically massaging the tendon parallel to the fibers rather than across the fibers. I'll put a link to a video describing that process in the description below. In some people, tightness in the calf muscles might be aggravating the Achilles. If that's the case, you can try foam rolling. Either both sides if the pain is too intense, or to increase the intensity, You can put one heel over the other. But be careful not to roll the Achilles itself, just the calf muscles. In the long term, it's a good idea to do some kind of general strength training routine. In many cases, an overuse injury is the result of an imbalance, where one part of the body is overcompensating for a weakness in another. I'll put a link in the description below to a video about strength training for Kendo and Iaido. One option you may want to consider to give your left Achilles a break is switching to Hitari Jodan. That way you'll be pushing off with your right foot instead of your left foot. Of course, you'll have to talk to your sensei to see if you're ready to learn Jodan, but switching to Jodan may allow you to keep practicing and still give your left Achilles a break. If you have a lot of stress in your life, whether it's work stress or any other kind of stress, then you probably have a lot of cortisol running through your system. Cortisol is a stress hormone and it can hinder recovery. You may have to take a more holistic view of your recovery and try to reduce stress, whether it's through yoga or meditation or going for walks. Also, one of the less obvious dangers of training through an injury is that you can ingrain bad habits from trying to protect that injury. The most important takeaway is to listen to your body. If you want to have longevity in Kendo, as in any intense physical activity, then you have to know when you can push through the discomfort and when you have to take it easy. So please train smart.